the prone shoulder mobilization is pretty much similar, however, is a little bit more difficult because of the hands position. I'm going to stay in this way, this direction. I'm going to come around and explain why. Okay. When you have cold, when you're having the shoulder facing, when you're facing down, the first thing that you want to do is that, because you want to feel comfortable. However, how many of you is not comfortable to take the hands up? Try to take the hand forward. Can you do that? A lot easier. Take it backward. You see that is a lot harder, especially elderly or people who feel stiff in the shoulder would be difficult. So that is not an option. So what's the option? The option is really to drop the hand and then to mobilize it kind of that way. So it's a lot harder because I need to bend down. I need to bend down and I need to then mobilize the shoulder. So let's look at the three positions. Where are the three positions? Come around over here, it will be a lot easier. Maybe the camera, maybe this way. So first of all, attach to the outside of your leg. You need to bend 2 and 3. So again, this is 1, 2, 3, 4. Then you're moving yourself. Okay. Now, if you start doing it too high, it's not very good. So you really need to drop. Yeah? You can do it that way with only 2. Depends on the client, it might be okay. So again, putting the upper trapezius into a lax position, and this is a really nice way, if the camera can come closer, really nice way to work it. Do you feel how it's tight now? And now really nice and soft. And then you stretch down. Good. Next one, you can take the shoulders up, come from the opposite side, and then hold. You can do a few things here. You can hold that and go into here. You can do a nice mobilization. You see how nice the shoulder moves? So it's a bit like a figure of 8 with the two hands. Good. You can do a nice traction that way. Yeah. Or you can work underneath the scapula.
No, so nice.
How is it?
No.
Is their hand, does it sit there quite easily?
Some people, yes, some people not. So again, 3, 4 points, and then moving it and massaging. Or just the 2 hands. Good. And then you can bring that in a system upward. So one hand is underneath. And you're lifting it and drop it. Now sometimes this hand just slides, so leave it to slide, because what you really want is that scapular movement. Again, it's my body movement. Yeah, I want to see a lot of that. Even traction that way. You can do also to take the shoulder upward and then using your thumbs to have a compression here. It's really nice. However, you have to be careful again from taking their hands too upward. Ow, ow, not good. Yeah? Some people can take the shoulder only that high. They cannot take it higher. So really be kind of considerate. And what I'm doing here is really working on the spine almost. Yeah? Very nice and soft. Yeah? Come closer, please. Yeah? And what I want you to see, this is the spine. I'm on the side of it, and I'm pushing the vertebra. I'm not on the muscle. The muscle is here. I'm here. Really on the spine itself.
What's that do?
It mobilizes the joint of the spine.
Off the spine.
Yeah. Can you come in and I'll bring this. Can you come very close, all of you? Yeah, very close, even closer. Yeah. Because what I'm doing, I'm coming from the side, and I'm actually moving the spine itself. Do you see that? Yeah. So I'm pushing one vertebra after the other, and it gives a nice, very small movement to each of the vertebra, but still enough mobility to allow increased mobility of the spine itself between the vertebra. It's kind of it's a different massage. It's not, you don't feel the muscle, but you're pushing the bones. And it's kind of relieving, because it's almost like doing that a little bit, a small movement. Again, healthy people, no back, severe pain, and you do it mild. Should I repeat again all the technique? Yeah? Let's repeat that. So, coming from here, 1, 2, 3, 4, bend your legs and move it. So in a way, if I'm here, the hand would be here, and then I move it this way. You're holding the whole of the limb, and you traction it, you lax it, you massaging it with, you stretch again. Good. Or, if it's more comfortable for you, two hands position. Good. Which muscle I massage now? The rhomboids. Yeah, to remember? Yeah. Which muscle I massage now?
Latissimus.
Erector spinae or latissimus dorsi? But I come from the side. What I meant here, I'm looking at the spine and then push it a little bit.
What kind of a pathology would someone have if you're going to be doing proper spine mobilization?
That's it. I'm not going to look for pathology. I'm looking for people with normal people with stiff spine.
Okay.
The more pathology they have, the less I will do it.
Okay. So it's not, you wouldn't do that for someone that has this.
No. For example, rheumatoid arthritis, ankylosing spondylitis, all the names is actually for me to say, okay, it might be a local contraindication. Now, if they have it moderate, I might not still do it. I will do it on people without spine problem that having spine problem, which is stiffness, tension, headache, deadline, office workers, 98% of our clients. Once I start hearing, oh, I have arthritis in the spine, and I have rheumatism, and I have sciatica, I would actually less do it. I'm an osteopath and I will do it, but for you, I wouldn't. But it's really limiting yourself only very, very little. How many people with pathology, like severe pathology, you see? Maybe once in a while here and there, but we have to be aware of it. So it's actually the opposite.
Cool.
Yeah? Shall we start? Yeah, a little bit of other technique. There's still mobilization, but there might be mobilization slash oscillation. When remember oscillation, you just do that movement. So it's something that goes like that. You can do it more without. It's almost like slapping a little bit. Yeah? Or you can do it this way. Really feel the heaviness. And again, it works well with people who have a lot of resistance, tension. This way, that way. You can even just tell them to drop it. So someone with high resistance, it would be kind of trying for them to try to do it. But that's exactly the people that we need to do that. Another would be of the supination, pronation, very fast. Yeah, really nice to office workers, massage therapists, people who work with their hands. Yeah, so you're taking the two group of the muscles and you're just running it fairly quickly, all the way to here. Yeah, good. You can do even a bit of slapping while you're doing basically internal, external rotation of the shoulder. Yeah, good. Another one, you can put their hand in between your legs and just lift it. Yeah, stretch it out. Yeah, even with oil, you can do a really nice kind of biceps, triceps together. Yeah, it's very handy, very nice into here. Working around the scapula. Yeah, come a bit closer. Here, your palpation is very needed. So imagine the scapula like a triangle of bone, and I can feel actually the lower angle, and then the scapula goes up to here and here, and then it travels that way. So on the lateral side of the scapula, if this is a scapula, on this side there are two muscles that I want you to know, teres major and teres minor. Yeah, and what they do, they attach to the shoulder, to the humerus. So it would be nice sometimes to separate those. So you can put your hands and massage the lateral side of the scapula. And I do use the side of my wrist to do that, the base of my wrist to do that. And then from there, you can massage, mobilize the ribs. You can do it either this way, or from here, you can really do side to side. Who do you think would benefit from that? Asthmatic? Yeah. Scoliosis? Yeah. Scoliosis, lordosis, kyphosis, people with kyphosis, yeah, that you start moving side to side, increasing the ribs movement. You can do that a bit faster or a bit slower, side to side. So again, shoulder. This movement is external, internal rotation. Yeah, you can do it a bit of more of a throwing, and what it does, it creates like a rebound that the vibration goes deep into the connective tissue, muscles, ligament. Yeah. Then you can do that on the. This is actually a forearm. Do you see what happened when I do that? Look at her hand. Yeah. Do you see that? Turning this way. Do you see what happened to the hand? Yeah. Mm-hmm. Supination, pronation. Yeah. Then put the hand in between your knees. teres major and minor. You can even take it to a nice stretch in here. Ribs, one side, and then ribs mobilization both sides. I'll be here to help you. Posture, don't break your back, get your legs tired.